Hi guys, thanks for all the votes on the first aid poll on the support group. The first aid technique that received the most votes was for choking. So following this, there's a video showing you the skills of what to do if somebody's choking. Let's just go through them quickly here. So the first thing to do is to ask the person if they can cough. You're hoping here that if you're lucky, they might be able to cough it up. You as a first aider, you look good, you've done your job, and with the minimum amount of intervention. So first of all, ask them to cough. If that's not successful, we're going to lean them forwards, and then we're going to do up to 5 back slaps. So these are firm hits to the back with the flat of the hand between the shoulder blades. We're hoping here to dislodge it. So up to 5, obviously we stop if we're successful. So up to 5 back slaps, and then we're going to move on to the abdominal thrust that used to be called the Heimlich manoeuvre. We would call it these days the abdominal thrust, or maybe another name we can use is actually the J thrust, because it's giving you an idea of what you're doing. So we're coming from behind the person, we're going around their widest part of their belly, and we're joining our hands together and we're coming in and up. So that's the J shape. So we're coming in and up, and it's a shock to their air systems, and that pushes pressure underneath the blockage. So remembering, ask them to cough, up to 5 back slaps, and then up to 5 abdominal thrusts. If that's not successful, I would start to be shouting for help so that somebody can come and give you assistance. They can call 999 whilst you carry on. Now, for first aiders, the only procedures we have really at the moment are the 5 back slaps and the abdominal thrust. So we're going to keep repeating them. Okay, so the skills are in the video in a moment, but just to make sure we're clear here, we do a different technique with babies because they don't have the strength in the abdominal area. So we're going to do small chest compressions on the baby. I'll do a separate video on this. This was aimed at adults, so just keeping in mind with babies, we don't do the abdominal thrusts. And the other side would be that if you have had to do abdominal thrusts on somebody, you should report it through your accident books or accident forms, but also advise the person that they should be checked out. It's not an emergency, but there is a chance that having done the abdominal thrusts, you might have made some sort of bruising or some damage, and we'd want that checked out. Okay, so make sure you report that, especially if this is within the workplace. Make sure that's reported and follow that up with them being checked out. Lovely. Again, thanks for engaging with the first aid group on Facebook. Please keep the questions coming up there, and have a good day.